IV is in. Just talked to the anesthesiologist. We're going to do general anesthesia rather than a spinal. Surgery should take an hour, and the surgeon will be in shortly to doc. So, feeling good so far. They put you in these little booties. There's my previous scar. And it sounds like I'm going to have one on the outside for this one. Swelling isn't too bad this morning, just a little. Sounds like I get in. Here's my first scar, and second, I guess I get a new incision with a new scar this morning. The drugs are working. Great news. Surgeon just came in and said I was worried about recovery being really long. When I was in PT on Monday, he said I could be in a cast for up to 6 weeks, non-weight bearing, and I was not expecting that. So I just asked the surgeon, and he said, no, you will most likely be a walking boot. So I am excited about that. That was the best news I've had all morning. Don't worry, my mom's not crazy. She just had hip surgery 2 weeks ago. She's doing her exercises. Mom, turn around. See your shirt. Bionic hip club. Third surgery. Let's hope this is the last one. I'm out. Feeling a little nauseous right now. Very nauseated right now. Not feeling 100%. Apparently, I had a tougher time with general anesthesia this round and felt like crap when I got out. I've been resting here for the last, how long? Hour and a half? Feeling so much better, and I'm ready to go home. 2 hours? 2 hours? I don't know. All I know is there's mommy. I feel so much better. Just a quick recap on today. As you see before, it was my third surgery on my ankle. I had to check in at 6:15 to the hospital. Got there, got the gowns, peed in a cup, temperature, blood pressure, got my IV in. Anesthesiologist came and talked to me, discussed different types like spinal, epidural, that kind of stuff, which I did have for my first one. But we decided on general anesthesia today. And in hindsight, I think I would have maybe done something different. I had a very difficult time in recovery. Like, was not expecting that. Usually after the second one, I mean like 45 minutes, and I was ready to get out of there. Nope, I was in recovery for 3 to 4 hours. I was probably pretty much the way I can describe it is the worst hangover of your life times 10. Room spinning. My brain, my head was not happy. I was going back and forth, moaning, just in agony, and finally reclined to the chair more and drifted off into sleep. And I was in recovery for, rather than 45 minutes, 3 to 4 hours. Yeah, a little different from the previous time. And felt so much better. after taking a nap in recovery. Headed home. I puked a little bit when I got home. And then I ate right when I got home, and then went straight to bed and slept from 1:30 p.m. to 8:30 p.m. With the exception, I was up for like a half hour. My nieces came over and gave me a little get well gift basket, so felt good to rest. Pretty much stacked all these pillows and just layered them with a big blanket to keep my foot elevated today. But my sister-in-law just brought over a big bean bag of the girls. So that is up in my room, and I'm gonna go to bed soon. And let's hope that that bean bag works better. These pillows, I feel like, are always falling. So, and we all know how much we have to elevate that first week. So, I was gonna get one of those wedge pillows. Probably will this next week. There she is. So this baby is my cast. This is actually ice right here. Kind of nice. You can just undo these and a long piece of ice comes out. This is not, the most part of this, as you can see how huge it is gauze. And then, you hear that? That's hard plaster on this side and on this side. It's not the whole entire thing, it's just on both sides running up, and then a ton of ace wrap, and they tape it down. So I'll have this for 1 week until I go to the post-op appointment. He'll take this all off, look at the incision, and then we'll decide if I go into a hard cast or a walking boot from there. But for the next week, I've got this. I've got to keep this as dry as possible. I'm going to search out some ice here on my, put them in the sleeve, and then get this ice on my ankle and head to bed. Get it elevated the best I can so I can get a good night's sleep. And that will conclude the first 24 hours of this surgery. Have a good night.